Let's go outside the rhetoric for a moment here and the arguments over health care reform. The big question for everybody is, will you be able to get the best possible care when you need it? And this morning we're focused on advanced surgical techniques like robotic surgery. This type of surgery is literally on the cutting edge of medical science. And our next guest says it is cost effective and that it actually helps people recover faster, gets them back to work faster, and all of those good things. And the reform plans on the table right now could block it, access to this for millions of people. We're going to find out why. Our guest, Dr. David Samadi, he is the chief of the Division of Robotics and Minimal Invasive Surgery at Mount Sinai. He's the man that you want to go to if you want something taken out easily and you want to get back to work quickly, right?
Thank you for having me, Martha.
Good to have you here, doctor. First of all, tell everybody the kinds of things that you perform, the kind of surgery you do.
So I use robotic surgery in order to remove the prostate cancer. And men usually travel from all over the world. We have Europeans, Canadians coming to our practice, not only for removal of prostate cancer, but mostly in order to have a better quality of life. And while the expense of the robotic technology is higher here in U.S. compared to other places, we're thinking long term. If these guys can get back to work earlier, right, they have a better quality of life, better sex life, and better urinary control. We have done, at least I've done my job, as far as taking care of these guys, and that's where we are.
So tell me how you do the surgery. You know, for the layman out there, for us who don't perform these kinds of medical procedures, and how different it is in the recovery from the usual procedures.
A few small keyhole openings. There's no more incision, so therefore there's really not much pain. Right. Prostate is removed. Patients typically spend one night at the hospital, go home the next day, and within 10 days, 2 weeks, they'll be able to get back to work. So it's an amazing difference. Now, compared to a lot of other options what we had in the past, whereas radiation or hormone therapy, this is the only option where it removes the entire prostate. Right. Patients will know within 6 weeks where they stand with their life. Right. Their PSA or the blood test has to be undetectable. And I'm very fortunate as a surgeon to have not only the science, but as technology, the whole team, and be able to take care of these men.
That's why this is such an amazing procedure, and that all of these, similar procedures are so groundbreaking in medicine. So we're being told that your health care won't change. If you like your health insurance plan, you'll still be able to get what you want. If you have the money to pay for a procedure like this, you'll be able to do that. But you say no?
Well, I think we're at the point, we're at the fork, and we as a nation need to make a decision here whether we're just going to concentrate on the cost or we're going to after the quality of care. And I'm still convinced that despite all said and done, we still have the best health care system in the world. We're thinking about technology, science, research.
But what do you see? I'm sorry to interrupt. What do you see in this plan that makes you think that we won't be able to have this kind of service under this plan?
Well, I think men and their spouses should have the option. And that option should be available. By limiting them, I just had a conversation with another insurance company 2 weeks ago that's telling me you don't have to do it robotically. I can send someone to do it open without considering what's going to happen to this patient. We need to take care of our doctors so we can take care of the patients. And the more gap exists between the physician and the patients, the worse the quality of care is going to be. And I think we need to make sure that we're not going to change it for worse. Keep the quality the same way. People have endoscopy, CAT scan, robots, and all of that is available.
People come from all over the world and all over the country, away from other medical programs in their countries, to come to New York to get this kind of thing done.
It's all here.
It's good. All right, Dr.